It's on half a day. Half a day. Welcome to GRMC's first Gubernatorial Healthcare Forum. My name is Cindy Hansen. I'm the Communications and Social Media Specialist, and it's my pleasure to welcome all of you here. And of course, I'd like to welcome our esteemed panel of guests and thank them for joining us here today. Beginning with ladies first, of course, as a courtesy, we'd like to ask you to join me in welcoming the team of Senator Lulian Guerrero and former Administrator of the Courts of the Judiciary of Guam, Mr. Josh Tenorio. We'd also like to welcome Lieutenant Governor of Guam, Ray Tenorio, and his running mate, Senator Vicente Tony Ada. Also, Governor Carl T.C. Gutierrez and his running mate, former Police Chief Fred Bordallo. We'd also like to welcome Senator Frank Blas Ugin Jr. and his running mate, former U.S. District Attorney for Guam and the CNMI, Alicia Limtiaco. And Senator Dennis G. Rodriguez Jr. and his running mate, retired Air Force Colonel and educator David M. Cruz. I would also like to recognize some of the other dignitaries who are present here today, beginning with our own President and Chief Operating Officer, former Lieutenant Governor of Guam, Dr. Michael Cruz. I'd also like to recognize Senator Regine Bisco-Lee, Senator Rory Respicio, and Senator Jesse Lahan. We'd like to begin our event on the right note and ask for the Lord's blessing. And in that endeavor, I'd like to ask our VP and Chief Financial Officer, Mr. Ted Constantino, to please lead us in a prayer and the blessing of GRMC's first Gubernatorial Healthcare Forum.
Yes. Let's all remember we're in the holy presence of the Lord. In the name of the Father, Son, Holy Spirit, amen. Almighty and eternal God of integrity and truth, we pray for wisdom as we engage our candidates in this gubernatorial healthcare forum. Give your anointing to our gubernatorial candidates and guide them with their endeavors and make them a vessel of your grace to touch the lives of our people and to seek to be worthy of your love. Lord, mold us all to your heart and use us as a channeler of your compassion. Help us to be worthy of your trust, that we may be all instruments of peace and hope to everyone, and grant us courage to be agents of change to achieve our dream of transformation. Finally, we ask you, Lord, to unite all of us in our thoughts and actions, set aside our differences, so that we may all listen and speak with one voice, with sound minds. We pray that peace, compassion, truth, and justice may prevail among us, and make us all a blessing to all the people of Guam. This we ask through Christ our Lord. Amen. Thank you.
Thank you, sir. Thank you. I'd like to call now on our Chief Executive Officer and Chairwoman of the Board, Ms. Margaret Benzon, who would like to officially open our forum with some opening remarks. Ladies and gentlemen, please welcome Ms. Margaret Benzon.
Okay, thank you very much. I'd just like to first echo Cindy's words of welcome to our gubernatorial candidates, the lieutenant governor candidates, especially the GRMC family and our special guests for today. We actually just finished celebrating our 3rd year anniversary, and the theme of that anniversary is, as you can see from our t-shirts, 33 because of me. And the me here, this is not any kind of statement of hubris or, you know, a bloated sense of self-importance. This has to do with real personal pride. Personal pride in the personal contributions and even the personal sacrifices that all of us have made to get us to 3. And simultaneously, more significantly, I think it's a real commitment, a real personal accountability to see us through to 33 and even potentially 133. There's a lot of me's in this equation, and I sat down this morning trying to figure out just how many me's can stake claim to our 3rd year anniversary and have a real vested interest in getting us to 33 and, like I said, even 133. So I did a little bit of calculation, and if you'll bear with me, I prepared this slide. So obviously the first are our staff counts. So there's 682 full-time staff in GRMC, and there's another 355 contracted staff as of today. So that takes us to 1,037 people who are engaged in and making their living from and through GRMC. And then there's our patients. They're family members, right? So using the Guam household multiplier is 4.07. So to get to the family members of the staff, we multiplied by 3.07. And so that takes us to 3,184. And then we get to our patients, who from the first day we opened, which was July 2015, 47,547. 47,547 unique patients that GRMC has served since July 2015. Now, so we're not double counting. I said, there's got to be some patients that are already counted as staff, right? So I asked that we figure that out, and there's 1,458 patients who are also staff and or family of staff. So our net patient number is 46,089. Now, we want to consider the family of those patients because we have impacted their lives too in very positive ways. And I was also thinking, most likely some of these patients are related to each other, so it's not exactly appropriate to use the same factor, 3.07. I said, what if we use half? What if we use 1.5 as a factor to get to the family members of the patients who are not staff and who are not family members of staff? So that takes us to 69,134. And if you add all these together, we have a whopping 119,444 people who are interested in GRMC, vested in its success, and committed to that success going forward. And then there's all of you guys, who we consider me's as well. You have been supporters of GRMC from the beginning, and now that you are candidates, we're looking to up that level of support, up that level of commitment, up that level of engagement, to really get connected to you in very substantial, significant ways, so that together we might think through, and most importantly, execute healthcare reform. Substantial healthcare reform, significant healthcare reform, sustainable healthcare reform. And reform that recognizes the central role that GRMC has played, is playing, and continues to play, and will continue to play prospectively, so that we do actually get to 33. And we will actually get to 133. We're kind of in the unique position of being a private enterprise, but delivering a public good. So we do consider ourselves, as you should as well, a public resource. And we all know this, you guys maybe most of all, that health is such a basic right, such a fundamental good, that it is possibly translatable to affecting reforms that are substantial and significant and actually extend beyond the healthcare arena itself. The big dream is better health and better life for everyone in our community, and we want you to consider us co-dreamers, and even more importantly, co-fulfillers, if there's such a word, of that dream. Unfortunately, the rhyme doesn't really work. It should really read "three because of us." This us is all of us. Us, the families, the patients, the staff, the leadership. And we're considering your presence here today as a continuing yes to the invitation to be part of that us. And we thank you for that. We're gratified for that and we're grateful. And thank you very much for being here joining us today.
Thank you, Ms. Margaret. So we're going to ask the candidates to make their opening remarks. And in order to establish an order in which the candidates will speak, and to do so in a way that is fair, sometimes you hear the phrase, well, we'll pull names from a hat. So we thought we'd really pull names from a hat. So each of the gubernatorial candidates' names is written on a hat, or is written on one of these. And Ms. Margaret, we're going to ask you to come and pull the first name. I'm going to let you open it up so that no one can say, and who is it?
It's
Lilian Guerrero. It's Senator Lilian Guerrero. Yes, ma'am. Yes, ma'am.
Senator Uggen.
Senator Uggen, you will go second.
Governor Gutierrez.
Governor Gutierrez.
Governor Tenorio.
Lieutenant Governor Tenorio. Senator Rodriguez. Awesome. Okay. Okay, so that is the order that we will have our introductory statements, and also the order that the questions will be answered. Starting with the opening statement, each candidate will have a maximum of 3 minutes to give their introductory remarks. Our official timekeepers today are Ms. Joy Garcia and Ms. Crystal Vasquez. Where are my ladies? Right over there. Those are our official timekeepers today. The ladies will be counting down the 3 minutes, and they also have time cards if they could show. There we go. They're going to be holding these up so that the candidates will know when they have a minute remaining, 30 seconds, 15 seconds, 5, and when your time is up. Oh, and they have a bell. That's even a surprise for me. We like to keep things moving here at GRMC. Okay, so we're going to go ahead and let Senator Lilian Guerrero give her opening remarks. Thank you very much. Welcome.
Thank you very much, Cindy. And thank you, Margaret, and management and staff and employees of GRMC for allowing us this opportunity today to visit with you and to talk about what our plans are around healthcare and around the community as a whole. I am a nurse by profession. That has been my first love in the 3 chapters of my life. I chose nursing because I am a very compassionate person. I chose nursing because I like to help those who are fragile, those who are sick, those that can't have a voice, those that need help. That has always been my inner character and my inner spirit. And that's why I chose nursing. When I was a nurse, I worked in critical care, the most serious, but the most critical of all nursing professions, because you have to think quick, you have to be smarter than the doctors because you're there with the patient 24 hours a day. So that has given me a lot of practice about judgment and character. And when Lieutenant Governor Mike Cruz asked me to be part of the GMH board under his administration, I so gladly welcomed the responsibility. And within 2 to 3 years after I became a board member, we got GMH accredited. And why did we get it accredited? Because the leadership at the hospital there was totally bought in. The doctors were a little bit skeptical, but they finally got on board. But most importantly, the administration supported us. And after 26 years of being not accredited, we became accredited. I am totally upset and disappointed that this administration has managed to lose that accreditation. That is unconscionable. And when I become governor, you be sure that I will bring accreditation back to GMH. GRMC is accredited, they're recognized, they're up there, their reputation is good, GMH's reputation is good, but we need to get back accreditation. What I would like to do as a healthcare reform is get GRMC and GMH together when I become governor, put them in my room and say you cannot leave until you guys get together, share resources so we can improve the lives of our people. So please, on August 25th, vote for a nurse for better healthcare in our island. Thank you.
I'm going to turn the mic over to Senator Uggan in just a moment, but I also wanted to let you know that in addition to all of the media that you see here in the room, we are also broadcasting throughout the hospital, in all of the patient rooms, on lobby 4 and 5, and also in the main lobby, plus on Facebook Live. Sir.
Very good. Buenas and half a day. Magandang hapon po sa lahat. Good afternoon, everyone. You know, it's wonderful to see, first and foremost, that I am standing in a facility that was dreamed of not even more than 6-7 years ago. And on July 20th, 2015, you open your doors. 3 years later, you have 1,037 full-time or part-time employees who are earning their living and contributing directly towards healthcare services for our island community. And also, in addition to that, you served so far to date 47,300 or 547 patients that you have been able to care for in 3 years. I don't know what is a better partnership in healthcare industry than GRMC. You are doing what the initial investors had dreamed of many, many years ago, about making sure that there's another hospital that is available for our people to be able to receive good, quality, safe medical treatment and care. And I say that because I have walked through your front entrance 4 times in the last month and a half. 2 times because, unfortunately to me and the family members, the good Lord decided to take some of our very close family friends. On 2 separate occasions, you were providing good quality medical care to 2 other individuals. As a matter of fact, my first cousin had a massive stroke. He was brought to this facility, and for 2 months, you provided care on a daily basis so that he was able to travel off island and acquire additional treatment, which was necessary. So I love the partnership that you have established here in the healthcare industry. Magandang hapon po sa inyong lahat. Mga kaibigan, ako po si Frank Blas Ogun Jr., tatakbo bilang gobernador at si Alicia Limpiaco tatakbo bilang BC Gubernador. Humihingi po ako at si Alicia ng inyong suporta sa darating na halalan. May tiwala ako sa inyo sa naniniwala ako sa Guam. Maraming salamat po.
Thank you very much, sir. I'd like now to ask Governor Gutierrez.
Good afternoon, everyone. For those of you that know me, you know me as a person that's very decisive in leadership. What Guam needs right now is decisive leadership as we move forward, particularly in healthcare. Fred Medallo and I believe that healthcare is the #1 issue on this island. And so let me tell you that maybe I just want to answer question 1 and 2. Here's what's going to happen when we take office in January. The governor of Guam, under the Organic Act of Guam, the Constitution of Guam, the federal law that put us together, gives the healthcare responsibility to the governor of Guam. And as such, the first thing I'm going to do is to be able to declare that I am the administrator of the Guam Memorial Hospital. No one will be there. And I'll know also that there's a problem at the Guam Memorial Hospital, and that hospital cannot continue to move forward the way it is limping along. I know that this hospital, I was so happy that it came into Guam, but we want to be able to make sure that it survives together. And I've already been thinking over the last few months, what am I going to do to be able to have this synergy between GRMC and GMH? Here's what we're going to do. We're going to pull together, because I'll be the only one negotiating, not the legislature. I'll be the one negotiating with the organization of GRMC, and we're going to say, what about this? Give you some ideas. How about Guam Memorial Hospital, for example, being a women and children hospital? How about you taking over SNF? Because now it's 30 beds up there are warehoused and are not being used. How about if I give you maybe a wing at Guam Memorial Hospital and let us be able to share the resources, because you, GRMC, can be able to pull in not only $1,100 for Medicare payments, but up to $4,000, because you know how to make it work and you know how to keep the record straight, so that CMS is going to give you that and approve it. So what we're going to do is to marry the two, Guam Memorial Hospital leadership from Carl Gutierrez, GRMC, put it together and come up with one healthcare provider, Guam Memorial Hospital, GRMC, and share the resources and do who does best. If Guam Memorial Hospital can take everything, and I'm understanding that there's going to be one doctor here that's going to be doing your heart surgery starting Monday. So we'll have everything in Guam. I don't want our people taking off from Guam and dying in an airplane trying to go to Hawaii or the Philippines to get a heart surgery. We want to be able to, ladies and gentlemen, put the two together, and I can do that because I'm very decisive, and that's what I want happen. Guam Memorial Hospital, GRMC, is going to be one entity working together.
Thank you very much, Governor. All right, we're going to turn the floor over to Lieutenant Governor Tenorio. Okay, great. Senator Ada.
Good afternoon, everyone. You know, it feels good to be here. I had the opportunity to be here when you guys first opened your doors. Dr. Felix Cabrera took my family and I around giving us a tour, and all the way up just until yesterday when I came to visit a patient up on the 5th floor. The quality of healthcare here is just unprecedented. All of you have contributed in one way or another to the success of GRMC. And I'd like to thank you for inviting us today. You know, I know firsthand how healthcare is important to the people of Guam. Running a funeral home, I see the pain and agony when someone loses a loved one. We made many improvements to healthcare. New clinics have opened. New life-saving treatments are now available for stroke, heart, and cancer patients. This world-class hospital, the Guam Regional Medical City, opened its doors, adding 130 new beds and services. And while GMH lost $30 million a year for the last 4 decades, We will continue to fight for a dedicated funding source to make GMH viable once and for all. With all the political drama, rhetoric, and promises that comes with an election, you will have to sift through and decide who to vote for. Many of you are looking for leaders with experience, leaders with a track record of success, and leaders who can hit the ground running on the first day of office. Look at our track record. Unemployment has dropped 13%, has dropped from 13% to about 4% today, and it's been the lowest in 25 years. Household income has gone up nearly 20%. For those of you with children who are concerned about their education, in the last 7 years, the high school graduation rate is up by 14%, and the high school dropout rate is down by 46%. And we are enrolling and graduating more people in colleges like UOG and GCC. Look around you. There are new businesses opening everywhere. Restaurants, hotels, this hospital. Our tourism industry has been diversified, and arrivals are now at historic record highs. The military buildup is upon us and will create an abundance of higher paying jobs for our people. A tutorial ADAT team will work to further improve our island. Our tuition-free college initiative will create thousands of high-paying jobs for our children. We already started. We secured $1 million to send 200 of your students to GCC and UOG and the Guam Trades Academy. With education, we will create a better Guam. Thank you all for having us here this afternoon.
Thank you very much, Senator. And the final opening remarks come from Senator Dennis Rodriguez.
Hafide, good afternoon to everybody. You all can clap when she introduced me. Thank you. I want to first thank Miss Margaret, Dr. Cruz, and to all of you here for inviting us to this health forum. Very exciting. I've been the healthcare chair in the Guam legislature now for the past 8 years. And I've worked very closely with Margaret, with Dr. Cruz and their team here. See Eric over here. About 6 years ago, I want to share with you that I went to Medical City. I saw Margaret there with Dr. Alfredo Bengzon. I had a very, very good time there. This was before GRMC was open. I got a chance to have lunch with him and visit the hospital, tour the facility, and visit the patients from Guam there. And I knew back then already that Guam is going to shine. When this company decided to come to Guam and open a new hospital, when other people were scared, were saying, we don't need another hospital here, we have GMH, I saw the bright future for Guam. I said, we need a new hospital here, and look what you have done. The 45,000 patients, by the way, I'm part of that census. A few months ago, Dr. Cabrera came to see me in the ER. I guess I was just tired. I had this ulcer attack, but he came to see me, as I want to thank you and thank the doctor and nurses who treated me there. But I tell you, I see GRMC and GMH working as one. I know that, Doc, we've tried many times to bring in management from GMH, from this administration, to come together and truly work together, not just the lip service, because that's all we've been having is lip service. Ladies and gentlemen, when I become governor, I'm going to bring the two, GMH and GRMC, and I'm going to make that decision that we're going to be one healthcare system. It doesn't matter if this is a private hospital, it doesn't matter if it's a public hospital, we serve one people, our people of Guam. And what has been happening now is you see the lip service of leaders say that they're going to make sure that both hospitals work, but it hasn't been happening from the top. As governor, I will ensure that that will happen because I know that when you work together and collaborate, we'll be able to deliver a better service for the people of Guam. Ladies and gentlemen, we are the only gubernatorial team here that's offering you a real plan of action. If you haven't received our red booklet, you should have received it in your mailboxes a few weeks ago. Download a copy of WeLoveGuam.com. Look at exactly how we say we're going to fix healthcare in Guam and truly make it one healthcare. I'm very happy the questions that you have to share with you and how we're going to do this specifically, the strategic plan, and knowing what the root cause of the problem is not only going to help GMH, but it's going to help the healthcare infrastructure all together. So ladies and gentlemen, on August 25th, please give the youngest guy the opportunity to work for you. Rodriguez Cruz. Jesus Masi, maraming salamat po.
Thank you very much, Senator Rodriguez. We'll now begin the question and answer portion of the forum. All of today's questions have been submitted by GRMC employee partners. 3 of the questions, just so you know, were provided to the candidates in advance so they had time to research their responses. These were the most complicated of the questions that came to us. The other 3 questions will require spontaneous answers. Each candidate will have 2 minutes to respond. And again, we will begin with Senator Leon Guerrero. You guys are very welcome to stay seated if you like and just use the microphones that are on the table. So the first question is, does your team have a strategic healthcare plan for the island and how will it be implemented?
You know, when Josh and I decided to run for governor and lieutenant governor, we went around and spoke to many people. We invited nurses, we invited doctors, we invited healthcare professionals to come speak to us and sit down and discuss what they felt the concerns are and what we need to do. So we do have a very well thought out strategic plan for healthcare. 1, we have to look at prevention. We have no gubernatorial candidate up here has ever talked about public health, about prevention. Public health is the gateway to health. I am going to make sure that we have the number of community health nurses so that they can go out into the community and provide health care and assessment to the people of Guam so they can prevent malnutrition deaths of babies out there. Then we look at acute care treatment. We're going to make sure that we address the challenges of the Guam Memorial Hospital. I am going to give the $30 million to Guam Memorial Hospital. We are going to fix their electrical panel that's dying over at Guam Memorial Hospital. Why? Because it is important to have acute care treatment and good quality hospital facilities. Then you look at rehabilitation and chronic care. Then you look at what the social services is all about so we can decrease child abuse, decrease sexual abuse, decrease our homeless, and so forth, because that's all about healthcare. We're going to do this through a healthcare summit to invite the experts with us to make it happen so that we can make the implementations that's necessary to provide quality healthcare for our people. Thank you.
Senator, I'm going to ask you to say a question. Do you need to hear the question repeated? Yes, please. Okay. Does your team have a strategic healthcare plan for the island, and how will it be implemented? Okay, Ms. Limtiaco will answer. You're welcome.
Thank you very much for the question, and half a day to everyone. The Agad Limtiaco approach to healthcare is one that is going to promote holistic, preventative, and competent healthcare. We believe very strongly that holistic healthcare, affordable, accessible, and competent healthcare is a right for everyone. We want to promote the prioritization of preventative care and expand incentive care programs so that we can really look at healthy living and lifestyle choices. The continuum of care model is one that many of us, if not all of us, are familiar with. Even in the work that I have done over the years in the practice of law with the Attorney General's office and even in the U.S. Attorney's office, working with healthcare providers and looking at the continuum of care model that starts from not only the time that a person becomes ill, but if we were to really focus on that model, look at follow-up and really throughout the duration of that person's lifetime. We also look at health and wellness programs and know how important it is that they're trauma-informed, that they're gender-appropriate, and that they're culturally and linguistically proficient. We have come to know and to review accountable care organization models that look at integrated delivery care systems so that, again, we're talking about comprehensive care that includes discharge planning, outpatient case management, social work, home health care, medication and treatment follow-up. We know that in other jurisdictions, there have also been the successful establishment of health policy commissions. And taking a look at this model that also includes members of the community, not only healthcare providers, but those that are also experts in financial management, so that we have the collaboration of our entire community. And so these are the approaches and strategies with the Agan-Lim-Tiaco team. Thank you.
Thank you. Did you need the question?
Yes. No,
It's right there. Thank you, sir.
This is very awkward to sit there and try, sharing one microphone, and then he sometimes doesn't want to give it to me. Ladies and gentlemen, Guam is part of the critical area hospital system in the United States. Usually the rural areas in the United States have 25-bed hospitals, or maybe up to 50 they can, but generally there. Guam and the territories, we have 155 beds at Guam Memorial Hospital, and they reimburse us for cost. The problem is that we have not, since like 1992, adjusted the cost that we can be reimbursed from CMS, from that, let's say, $1,100 for Medicare, while others are being justified here for $4,000. What I would like to do in the short term is to go in there and take over the hospital and take it to the legislature as a line agency. Right now, it's an autonomous agency run by people there that don't report to the governor as often as they would like. But I would take that and bring it there for full funding while we sit down with GRMC to make that synergetic relationship work for Guam. Because right now, we cannot continue with Guam Memorial Hospital that way. They lost all their records since 1992, is when they were first given this cost reimbursements of $1,000 or $1,100. You can't work that way. And so we have to be able to figure out how to extricate ourselves from that archaic management system that's going on there. And this is an up-to-date system. They know what to do. We can work together. And like I said earlier, that maybe we can share the resources or bring the hospital to take care of some of the facilities that are there, and to expand this hospital without any necessarily cost, to be able to provide under the Organic Act of Guam those patients that come that can't afford to pay. That will be then my responsibility to figure how to get those funds in, to be able to reimburse GRMC, to be able to pay for those non-payers, or even work out some kind of an insurance system that will make it work with this hospital.
Thank you, Governor.
Hafide, and thank you for having us here. Prevention is key. Lifestyle change, education, recreational activities, making sure we're renovating our facilities, having sports facilities throughout the community are important. We've done that, and our administration will continue to do that. But it's really important that we focus on getting, as a governor, I will get the $30 million dedicated funding source for the Guam Memorial Hospital. We can and we will get accreditation back, and we will maintain CMS. With respect to temporary rebasing, we've actually applied for it many times. We've been denied, but we have had adjustments. We're waiting for now about $12 million for the last 4 fiscal years adjustments. So we actually have increased the basing from about 1,100 to 1,347 now. We'll continue to get additional funding, but it's going to come down to funding, ladies and gentlemen, to this hospital costs money. The facilities, the personnel, they deserve to be paid well. We'll continue to raise compensation and salaries for many different areas, including nurses, which is the core of the medical service providers in any facility. So, but the long term, I think, is for us to make sure that we look at the long-term interest. We're going to have about 200,000 people on the island after the military build-up. Currently, based on 2014 ratios of 2.5 beds per 1,000 people, we're already short 200 beds in the current medical needs in our hospital. I will build, along with my partner Tony Atta, a university hospital. We will work to be able to not just do the education for our nurses and our therapists, be able to have, and I know we can do this, we can have homegrown, educated doctors here on Guam. We can do a medical school partnering with an academic institution and work with the municipal police to be able to finance this. Because I think that you all know there's an interest not only in academia but also in the private sector, as represented here at GRMC, that you can make money out of medicine. We will raise the standards, we'll make an investment on our people, we'll work on increasing the salaries and the compensation. But it really is a holistic approach, as one of the other candidates had mentioned previously. Prevention, making sure we get the finances, investing in a university hospital, and investing in our community. Thank you.
Thank you, Lieutenant Governor. Senator Rodriguez.
Sejus Masi for the question. But before I answer the question, I want to just make something very clear. It was said that no other gubernatorial team has talked about prevention. I invite you, ladies and gentlemen, to pick up your copy of our 10-step action plan. Starting on page 50, we talk a lot about healthcare and we talk about prevention. As a matter of fact, my family and I, about 2 years ago, with some friends, we put together this mobile clinic. And I see some of the great providers here, some doctors and some nurses who come out with us to give free physicals, to give free nutrition advice to our people, and to show them how not to get sick, to be healthy. So prevention is very key in our plan and what we're going to do in our administration. To answer the question, yes, we do have a strategic plan. It's part of our 10-step action plan. How we're going to do it, ladies and gentlemen, is what I put together in December 2016. This is called Healthcare Para Todo. What this does is expands our insurance coverage to our people. What's happening now is that our people don't have access to healthcare. We're always getting them on the back end when it's already in a stage where it's terminally ill for some of them, or it's very hard or costlier for you to be able to treat. We got to get people healthy. We got to get them access to primary care, to primary physicians, so that they know where they stand in their health and how they can ensure that they're healthy. So, ladies and gentlemen, I've done a lot of work in my past 8 years. I've worked with a lot of you here, and I know what it takes. I know what the challenges. I know what it's going to take to move our healthcare in that next level. We need to have one healthcare. We can't just think about healthcare and say it's only GMH. It's the whole entire system. The private clinics, this private hospital, Naval Hospital, we all have to be one. Thank you very much.
Thank you, sir. Before we move on to the second question, I would like to recognize Senator Francis Santos, who has joined us in the back of the room. Thank you, sir. Okay, the second question, which again comes from GRMC employee partners. How do you see GRMC fitting into the healthcare infrastructure on Guam? And if elected, how do you plan to maximize healthcare resources on Guam from both GRMC and our partner, Guam Memorial Hospital? And again, we'll start with Senator Liu.
I think I'll just stand here and wait for my turn so I don't have to back and forth. Thank you very much. I think GRMC plays a very significant and very impactful role into the whole healthcare continuum of our island and in the improvement of our healthcare quality services. What I see happening is that GRMC now provides oncology, medical oncology, radiation oncology. It provides a very aggressive wound care services and programs. It has a cardiac surgical suite that's been especially been built for a cardiac surgeon. So these are the specialties that I see that GRMC has. And why can't we partner with GMH? GMH can take care of more of the general kinds of services, can take care of pediatrics, can take care of labor and delivery, can take care of medical surgical, can take care of OB, like I said earlier, and has a lot of other resources. There are great human resources at GMH, and there are just as great human resources here at GRMC. Can bring in the specialists that you use. You guys have a good infectious doctor, not an infectious doctor, but an infection doctor. Doctors can get infectious, yes. Yes, and I was very impressed with her about her statistics. So why can't we get the specialists that we have here, work with our group of people and resources at GMH, and have one combination of services and better quality of services to our people, from high critical specialty to the general services provided.
Thank you, Senator Rivera. Senator Edgar, would you like to hear the question again? You got it.
Thank you very much, Cindy. You know, it's an excellent question because some of my opening statements really referred to the importance of the partnership that has been established within the healthcare industry of GRMC. And I emphasize that in my opening statement because it's not about fitting the Guam Regional Medical City Hospital into the healthcare arena. For the last 3 years, you already have serviced 47,000 plus patients. In the last 3 years, you have expanded your workforce and your professionals to a level of 1,037 employees to date. The question is, how can we capitalize on collaboration between GRMC and our public hospital facility, GMHA? Because if you really think about it, GRMC has been in operation for 3 years. You have the CMS rates for Medicare and Medicaid at 4 times the rate of what GMH has. In 3 years, you were able to acquire that. So you ask yourself the question, how can we harness the expertise of GRMC and collaborate with GMHA so that in fact we can get GMHA to be appropriately reimbursed with Medicare and Medicaid? Another thing is, this is a one island community, folks. This is our island. This is our home. We need to figure out exactly how we can have that integrated healthcare service system where GRMC is able to provide and maximize the services that you can provide in terms of medical treatment, and GMHA can do likewise. You know, it was shared with me a little while ago about that GRMC just upgraded its patient services to include expanded service to our stroke patients. That's what it's about. If GRMC can provide that service, we don't necessarily need GMHA to consider that, but to continue to capitalize on how it's providing services in other arenas. Thank you very much.
I don't have to call the governor, he's just always ready to go.
I know my number. Well, thank you. Without having to repeat myself, but the first thing I want to do as governor, after I told you all the other good stuff, is that GIDA, you're paying GIDA $1 million a year? I'm not going to have you give it to them anymore. I'm going to figure out how to get it to the hospital. Or maybe ask you to give us some kind of help to be able maybe to reconstruct some of those records, give them an idea on how to be able to convince CMS that what our costs are, because that's what we're being reimbursed, and we're not getting the cost as commensurate with what we provide as what the hospital does here. I want to be able, ladies and gentlemen, the governor of Guam is mandated by law to take care of the health of the people of Guam, but it doesn't mandate them to have a hospital. So not having a hospital, you know, is still within the Organic Act, as long as the people of Guam, in some way or another, are taken care of. I spoke with the Secretary of Health and Human Services before, who was a good friend, Secretary Tommy Thompson, Governor of Wisconsin. And after convincing him by showing him the Compact of Free Association and the Organic Act of Guam, and that we are, this was like 16 years ago, that we are providing these services based on federal law, but we are not getting what we're supposed to be reimbursed for, and that we cannot, you know, under the federal guidelines, get those funds. So he said that under the system that he has control of as secretary, he agreed, and he was going to come to Guam to give us public health doctors, public health registered nurses, not only for Guam Memorial Hospital, to give us an upswing for 3 years, but also to the Northern Clinic, the Central Clinic, and the Southern Clinic. So I want this hospital to be a part of weaning ourselves away from Guam Memorial Hospital. That's the part I'd like for you to see as pulling it off, so that we don't have to provide a total health care for the people of Guam when it can be put down here.
Lieutenant Governor, oh, another one, just ready to go.
That's an excellent question. We need both GRMC and GMH. Margaret Bengzon, of course, Dr. Mike Cruz, the Governor. Many of you know how many conversations we've had from the very beginning. Healthcare is improved on Guam as a function of GRMC and also our work at GMH. You all know that. We share a lot of the same expertise, the personnel. A lot of you have worked at the GMH. You know what they need. You know it comes down to funding, really. JCO accreditation, of course, we'll get that back. CMS will maintain that. But it really all comes down to it. GRMC is providing indigent care right now. GMH is providing medical specialties that we don't have at GMH. This sort of symbiosis, this collaboration, this partnership needs to continue, and it will continue in a Tenorio administration. We'll always work together with public health and behavioral health and make sure we're working with Naval Hospital. We all have a vested interest, as one of the previous speakers said. We're treating all our same people. And so we need to have that agreement. And Lieutenant Governor Mike Cruz and have many conversations. And we work together all the time. Our chiefs of staff, we always are working together. It comes down to what you can do together, what we can do together. Where you can make some business units and some business investments where we don't have to have redundancies and spend money where you're spending money. We already exchange supplies and personnel, expertise. We're already working to collaborate. GRMC is always going to have a role as a university hospital will also have in an academic setting and working with a public-private partnership to be able to enhance and raise the number of hospital beds and enhance the number of services and continue to be prepared for the next generation of patients. We need to work on prevention, but really GRMC has been a blessing for the people of Guam, and all of you have made that possible. So thank you very much for the question. Maraming salamat po.
Just Masi for the question. The question I believe is, how do we see GRMC fitting in the healthcare system? That's not the question. You are already part of the healthcare system. As Governor of Guam, I'm going to ensure that people fall in line. Health insurance companies. How ridiculous is it that if you are part of one insurance company and you live up north, that you can't come to a hospital that's closest to your home? That's ridiculous, ladies and gentlemen. Right now, we're working on legislation to make that happen, to ensure that all health insurance companies cover health providers here on Guam. It doesn't matter if you are GRMC, if you are down at FHP or Guam Radiology. You have to be able to cover the patients that want to go. Patients need to be the one to decide who their doctor is, who they want to go. Not anyone, not the government, not your doctors, it's the patients. We need to ensure that everything is focused on the patient care. We're going to break down that kingdom mentality that's been happening and ensure that doctors and everyone else that has been trying to block this progression of healthcare in Guam understand that it's not about them, it's not about their self-interest, it's about the people of Guam. It's about their own patients. So we're going to make sure as governor that we move that forward. So just Masi.
Thank you, sir. Okay, this is the third question, and this is tricky. The Department of Interior has not fully released compact impact funding due to questions it has concerning the methodology Guam has used to calculate the amount owed for indigent health care. For example, we bill approximately $152 million annually and receive only approximately $14 to $15 million back from the federal government, leaving a balance of $124 million owed to Guam each year. What steps would your administration take to unravel the Interior's questions about our methodology so that Guam can receive the full compact impact monies owed to us? Senator Leo, Mr. Tenorio.
Hi, good afternoon, everybody. It's been a long-standing issue, this discussion and a dispute with the Department of Interior about exactly what the true impact compact residents have on our island. So in our discussions and our strategy is that we lead a working group out of the Bureau of Statistics and Plans to scrutinize the reports that are coming in. Agencies are submitting reports. There haven't been any uniform guides to them to inform them about what exactly they're going to count. The Department of Interior has pushed back sometimes to ask what is the positive tax implications that compact residents and their descendants have on the island. If they're giving federal funds for in Department of Education based on student population, They ask why are we going to be, again, making a double claim, in their opinion, for funds that they believe they're already finding. So our strategy is really to scrutinize and discuss with them and agree on what the methodology is. Apply the methodology to prospective and retroactive reports so that we can come to an agreement about what is truly owed to the island. Coming up in 2020 is the U.S. Census. And in the last census, many people thought that there has been an undercount. It's very critical that we have a very prepared government to go and undertake the census to make sure that we count the number of compact citizens and their descendants that are here on Guam. And finally, partnering with the legislature and Guam's delegate to Congress and revising a Team Guam approach, using the Guam First Commission to have the different branches of government agree on the same strategy and collectively working towards that. And that will unify a message to the federal government and make sure that we're much more effective than we are today. Thank you.
Senator Urban?
Thank you very much. Excellent question. First of all, let me just say this much. Department of Interior, if in fact the government of Guam is identifying $152 million, the government gets about approximately $16.2 million, inclusive of jurisdictions, Guam, CNMI, and the state of Hawaii. There's a $30 million pot that is approved by Congress every single year. So we already get a bulk of it, but we need to figure out the equation as to how we can increase that $30 million allocation and then appropriately spread it out to Guam. The other issue is, first and foremost, if that's going to be the case, we need to ask ourselves, do we need to commission, with the cooperation and the consideration of the part of the Department of Interior, commission a study by a third party, an independent third party. Give that entity, that organization, or that individual an opportunity to be able to assess and to evaluate exactly what the impact is of our migrants who are coming in based on the Compact Impact Association. And then we can present that back to the Department of Interior. What's very critical is that we need to be forward-looking. The next negotiation for the Compact Impact is in 2024. Guam has to be at that negotiating table. We have to ensure that we are participants in that discussion so that when we talk about reimbursements, we have all of this information before them. And they would understand that if you're going to pass an agreement where the people of Guam are going to bear the challenge and the burden of paying these additional costs and absorbing this additional cost, then we need to ensure that if there's any agreement, that side part of the agreement is kept to the T, and that jurisdictions such as Guam, CNMI, and the state of Hawaii get the appropriate reimbursement, where there's $150 million of what rightfully should be given back to the community of Guam on behalf of our community. Thank you very much.
I don't believe the federal government is ready to relinquish any more funds totaling $130 million, not under the Trump administration. We have been for decades asking the Secretary of Interior to be able to figure out how our reimbursement methodology should come about. The problem is that they don't want to pay. So I believe, ladies and gentlemen, that for us to be able to do something that has meat on it is that our delegate can attach some language that mandates a commission that looks at the positive and the negative impact of the compact citizens here and come up with that methodology. But it has to really come from some kind of legislation in the Congress. These people would rather just spurn your movement forward coming there to talk to them. It's not going to happen. So you got to be realistic. If you want to get things to move, the delegate's responsibility. We're able to be able to get some kind of legislation through. Put it on the NDAA. Put something there because it matters to the military and the relationship we have here. We need a community that has a working relationship with the military. But if you don't set it up through the legislation, they're not going to listen to us unless you set up a really good personal relationship with the Secretary of Interior. But we need to be able to make sure that their next governor has the ability to do the networking in Washington, D.C., as I did when I was governor in 1995 to 2003. I set up a personal relationship with the President of the United States, the secretaries of the different departments, and was able to dislodge millions and millions of dollars to come to Guam from that personal relationship, because I was able to tell the true and the real story of the people of Guam and the contributions of Guam to the national defense and the national economic interests of the United States.
Governor.
Thank you. With President Donald Trump and as a Republican and a Republican Governor Ray Tenorio, I will go directly to him and work with him. This comes down to the Department of Interior, the Government Accounting Office, and the dispute they have over the formula. And so I will form a group along with Hawaii, the Northern Marianas, American Samoa, and work to make sure that the formula that we're working with, the Department of Interior, is in collaboration, because we really have to agree on where the disputes and the discrepancies are, as was mentioned previously. And some of the FSM citizens who have come here, who have had children, those children get to the age of majority, which is 18. Those individuals no longer qualify as FSM citizens, they're U.S. citizens. So long as that is true, they're not computed against the total. The formula has been scrubbed. We're working with the Department of Interior. Every year we submit a report, and the numbers have continued to grow, and at times they fluctuate. We're roughly getting about 10% of what we should be getting based on our computation. At the end of the day, it comes down to working collaboratively. And the one thing to do, I think, is to look at creative ideas. They may not in the Congress be willing to appropriate more money, especially to the tune of 120, is probably getting more closer to $200 million. So I think CNMI, Hawaii, and Guam might be able to harness about $100 million in the Affordable Care Act, which we're in jeopardy to lose, and we've been talking about, if we can offset the Medicaid to consider reimbursement, because if they don't want to appropriate, maybe you can stop doing these paper cuts, and some of those paper cuts are pretty deep. But we need to work collaboratively with our partners in the Northern Marianas, with Guam, Hawaii, come with a formula, make sure it's vetted, make sure it's worked with GAO, have the Department of Interior agree, have the bill introduced with one of our friends in the either House of Representatives or in the Senate, which again are both Republican controlled, and once we do that, get it passed by the body, and if you don't agree with 100%, give us 50%. But that's a substantial increase from where we're at. We will lead, we'll get resolution on this under Tenorio administration. Thank you.
Thank you, Lieutenant Governor Snow. Senator Rodriguez.
Thank you very much. The problem is that we've been doing the same things over and over. Here, the federal government telling us that they're disputing our numbers. What we need to do, which we're actually doing now over in my office, is that we're working with Health and Human Services to get a health information exchange on a real accurate one working here on Guam. If we do that, there's a 90-10 split. The federal government pays 90%, and we come up with a 10%, just like we fund through Medicaid, the 45-55. But with this, with implementing a health information exchange system, it's a 90-10 split. What this would do was allow us to get accurately the numbers on healthcare, just healthcare, we're talking about healthcare only right now, for those in the Medicaid system. And if we have a robust health information exchange available, then we can use that infrastructure now to look at other patients in other types of MIP, or even for those who are privately insured. But that's what we have to do, to be able to show the federal government the truth and the disparities. We can't just be doing the same type of calculation, same type of information gathering we're doing now. We got to get a good information exchange together and be able to prove to them what it really cost us to fund those people that come to our island from the other islands. So that's how we're going to address it. It's also part of our 10-step action plan. We've thought about this and we know how to deal with it. Sedus Mas.
Thank you very much, Senator Rodriguez. So that actually ends the questions that the candidates actually got time to do a little preparation for. Now we're going to actually take questions from the audience. Does anyone, well, we'll start with our Vice President of Corporate Affairs, Mr. Eric Linsky. We have a microphone, sir. And we will use the same order of selection. Senator Uggan actually had to leave for an engagement, and so Alicia Limtiaco will be answering in his stead.
Candidates, thank you very much for coming to our home. I appreciate your attendance. The question I have is, first, a little preface that first of all, GMH is our partner, so anyone in the community who confuses thinking they're our competitor, that's completely wrong, and from day one we see it that way. But it is important to note that at this very day, GRMC sees as much, likely more, indigent patients at our hospital, and that includes Medicaid, MIP, and the uninsured, than GMH does, and that grows every day. So if you're elected, what are you going to do to help, and this is particularly public health, funding, to make sure that all providers that serve the indigent population are reimbursed appropriately and timely? Because right now, we're not being done, public health is underfunded, and we're having to wait too long. And if all the focus is on GMH financing, we're all going to suffer and go down while maybe we resurrect GMH. So that's critical to us to find out how are you going to do it to make sure we're part of that picture. Reimbursement for our Medicaid, MIP, and uninsured.
Ms. Limtiaco? Should we, yes, we have to go in order unless you wanted to jump in.
Go ahead.
We'll go in order. Okay, Ms. Limtiaco?
Thank you very much, Eric, for that question. I think all of us know that there's not necessarily a black and white or an easy answer, but it's one that's going to take a lot of focus and, again, determination. In terms of what an Gubernatorial administration would do to ensure that there is appropriate reimbursement and timely reimbursement, especially in the in services that are provided by public health, as well as all of the other healthcare providers, we need to take a look at the establishment of a health policy commission. And earlier, some of the candidates here spoke about putting together or organizing a commission that would take a look at some of the critical issues that impact our community, including information, data that can be collected so that really we have what we would call a reliable basis of information in order to make some, again, informed, responsible, and fair decisions about not only the amount of reimbursement, but certainly the participation of all of these providers and the participation of public health. Another related matter to this is Senator Agun had in his work over the last several months included an amendment in one of the budget bills so that there would be reorganization, realignment, a review of duplicative services, and in some of the focus group discussions that we have had with public health professionals, it has been made very clear that they believe information that can be provided that would be very helpful could be through the full establishment of an epidemiologist who would be able to take a look at the healthcare considerations and ensure that, again, we have proper data from which to make some of these very critical decisions. Thank you.
Senator Leon Guerrero, I owe you an apology. I should have asked Governor Gutierrez what the order was, because he is better at remembering it than I am. Clearly, it was your turn. My apologies, and my apologies to you as well, Ms. Limtiaco. So I put you on the spot there.
Actually, I thought it was unfair for me to always start, and normally what happens is...
That's the rule of the hats. That is the rule of the hats.
Okay. You know, finances is very crucial in anything. And what we would do in our administration is we would first collect the uncollected monies, taxes, that are laying right on the table. $200 million of uncollected tax. That's a source that we can then push over to health care. Additionally, with the Obamacare Act, we had monies given to us through Medicaid. And we were supposed to use it over a certain period of time. That period of time is now expiring. And we still have over 118 million left on the table that we have not yet used because we have not gotten the matching grant. So if we collect the taxes, get the matching grant, there you go for providers and to pay for the services and the programs that GRMC provides. Not just GRMC, GMH, private clinics are also suffering from that. The other issue that we need to look at too is we need to start pushing more of our people into Medicaid, so that what happens is we can make the case in federal government that we are providing health care through Medicaid, so we can then have more of the percentages that come to our island.
Thank you, sir.
Eric, you know, I think your question should really be addressed to the Guam legislature. They're the ones that provide the money. Here's what's happened. I was listening to a recording in 2008 by Bill Clinton when he called the radio station Ryan St. Nicholas and trying to move that Hillary be selected here in the primary. He said that when Hillary wins the presidency in 2008, she would make sure that she lifts that Medicaid cap, because we have that cap here. Now, we are not pursuing, somehow, the Republican is there, we have a Republican administration, going there and asking them to remove the cap. Because once you remove that cap, then the money flows in. Having said that, the problem that we see right now is that the priority of health care under our administration will be number one. They will be funded first. Then you go to public safety, then you go to education. Obviously, something is wrong right now because we're going beyond the core responsibility of what government is supposed to provide for the people of Guam. Even in education, we've gone beyond the core responsibility on how to educate the children. We're doing all these extraneous things that bleed the core responsibility. The same thing with public health. You're doing different things that take away from what we're supposed to be providing for the people of Guam. So it's about taking the money, and our administration would go to the legislature first and say, fund the Guam Memorial Hospital, make sure that you fund what's necessary for Medicaid, and make sure that the clinics in the North, South, and Central are fully funded as well, because that takes away from the Guam Memorial Hospital being the primary care, or even here. So the key here, Eric, is to make sure that the governor of Guam requests first from the legislature those funds that you want paid to you, because it's not going to come from any governor of Guam.
Eric, thanks for the question. You know the system well. Inefficiencies exist. Personnel are required. You've got over 1,000 total employees here at this hospital and doing an exceptional job. You have the accounting, you have the information technology system. All the systems are working together. That's not true across the government of Guam. You know that as well. You've been to public health. You know the personnel there. You know what they do. GMA is similar to this situation. It really comes down to, as the governor previously mentioned, the legislature appropriating money sufficient to have the personnel and the infrastructure, information technology, to be able to process these things in time. Yes, we work with the federal government. Yes, we've gone out to receivables. As a matter of fact, there's a misnomer or misinformation or maybe just a confusion that there's no $200 million floating out there. After you take out the installment payments and the other things and protest and offers and compromise, there's about $73 million that's receivable. Usually there's about $100 million. So even if you were to go after the $73 million, it's not going to be able to cover the entire amount, and it's not sitting on the table like a glass of water that you could just pick up and take off. People don't have that money sitting around. Yes, we'd like to be able to make sure that we don't lose that money that we have from the Affordable Care Act, and we want to make sure we build those efficiencies. As governor, I will continue to work along with you, GMAs, public health, and all the providers to make sure that you get paid higher rates. Our reimbursement rates are very, very low. We've been working with the Congress, but there's a number of moving factors in politics, not just the Congress, but of course the Trump administration. We work collaboratively, we send correspondence, we'll continue to do that. The Trump administration, along with the Tenorio administration, we'll look along with the GRMC and GMAs to see what inefficiencies can be achieved. I will invest heavily into information technology. I think it's one of the most important things we need to do as a government. We need to evolve and get to the point where cloud-based technology and using not HIPAA, of course, all those standards to make sure we're protected, but using driver license, tax records, any given number of records, we need to move as a government closer to information technology so we can achieve the efficiencies that you need so you get reimbursed faster. Thank you very much for the question.
Thank you, Senator.
Senator Rodriguez.
Thank you. Sorry, Eric, I stepped away. Can you just repeat the question if you don't mind?
I'll use my voice. And
Sure, I can hear you.
It's basically, where the publicity that goes around Violent Guam is more that GMH is the safety net for the indigent population of Guam. Reality is we see as many or more Medicaid, MIP, or uninsured than GMH does at this point. But all the emphasis is how to make sure they're financially stable while we are stretched out, not getting paid on time for all these patients we're seeing. What are you going to do to make sure not just us, but all those providers, private providers, that are seeing the indigent population are paid appropriately and timely so we can all survive, not just GMH. We all got to do it. We need everyone here to come up with a great solution to that.
Great. Thank you very much for that question. I'll tell you what I'm doing now and what I've done. And Senator Lee's here, and she can attest to this. I'm sure she could. Because every time in the budget process, any time that I find resources out there for the government of Guam, I direct it to the Medicaid program. Because I know that directing it to the Medicaid program, we get more from that. You know, we match it with our local funds, and then we can now pay our private providers, pay GMH. The mindset for the past few years and over the years is that when you get money, dump it at GMH and we'll go solve our problems. That's not the way to go. You know, just this budget, I voted against this budget because one of the provisions there is allowing the governor of Guam to use the money that you would usually appropriate to GMH for the Medicaid program to allow, by executive order, for the governor to be able to make GMH use that in operations. That's not the way to go. You need to ensure that it goes to Medicaid so that the money stretches and ensure that we get the hospital here, we get our clinics paid on time. Part of what I've done in 2016, I said earlier, is the Healthcare Paratoli Plan. This plan expands the Medicaid coverage, where it ensures that more of our people can qualify for the Medicaid program. And the way we establish this formula is that it's not just going to be the government of Guam who's going to be part of that payer mix. It's going to be that individual, that employee. It's going to be that employer. And it's going to be a small subsidy by the government of Guam, so that we know that $100 million that's still left there, we got to be able to use it before it expires in 2019. And when we have a program like that in place, it gives us that seat at the table with the federal government to say, look, we know how to use this money. We're not just going to use it on emergency services at GMH. We know how to use it. We're getting our people access to health insurance, access to health care. Extend this program. We're going to go to Congress and let them know that this is what we've been doing. We can't just use the money and go back there and expect them to say, okay, we're going to give you extra, we're going to give you this money continuously. You got to have a plan. We have a plan ready.
Thank you, Senator Rodriguez. Do we have any other questions from, yes, this is Joy Garcia. She works in our Customer Relations Department.
Happening. So with the Customer Relations Department, one of our biggest responsibilities is tending to the concerns and the complaints, not just from the visitors and the outpatients and the caregivers that come through our doors, but also to our inpatients. So we make daily rounds and we visit them and we take in all the concerns that we have to include the environment of care. So the dark cloud that follows us, not only inside the hospital, but outside the hospital as well, because of our uniforms, our badges that we wear, is following Senator Rodriguez's statement. What power does the local insurances have to say who is accepted and who is not accepted, and what is your plan to ensure that all insurances are accepted here at GRMC, and what would you do to prevent them from pulling out of that promise?
Okay. We'll give Senator Liu a break.
Well, that question, thank you for that, I believe is dictated by law. The legislature passed that the lowest bidder will get the contract with the government of Guam. I didn't say the lowest responsible bidder. As a matter of fact, the judiciary has told me that they're not happy that they have to, that they've chosen a carrier, FHP, that does not want to send people here, and they want to come here. So the thing is that it came out of law that was passed by these guys that are in the legislature. So they shouldn't have done that. I mean, It costs maybe more for the government to match the funds of the employees, but it was there last time. Now one is pulling out because it's too low, because they tell you to be the lowest and not responsible. So I suggest to you that the lobbying that needs to go to the legislature, that's where it is. So we'll lobby Dennis to change that law, Dennis, because that's where you guys put it.
Thank you very much. I just want to let the governor know that I voted against that bill. I voted against that law. And I voted to override it. I believe last term, Senator Addo was there with me. I think you also voted to override that law that said we're only going to get one carrier. It doesn't make sense. We got to ensure, I said it earlier, our people, the patients need to decide which hospital they're going to go to, which doctor they're going to go to. Don't make the government, don't make insurance companies dictate that to you. As I said earlier, we're working on legislation to ensure that all health insurance companies cover all providers, not just this hospital, but all other providers. You know, if they're going to put some condition or whatever it is, that's what we're taking a look at. But we can't have insurance companies dictate where you as a patient wants to go. So I'm going to do it now. I'm going to hope and pray that I get the passage through with my colleagues. If not, as Governor of Guam, we're going to make sure, as I said earlier, we're going to make sure that health insurance companies fall in line. Thank you.
Thank you. Senator Liu?
I think there's two issues here that we're really talking about. One is the public sector, which is the government, and that is where the legislature can mandate government. They cannot mandate the private sector, people that work at Bank of Guam. They cannot mandate that Bank of Guam has to only provide one health care, or it can only be stay well, or it can only be because it's a private sector. So one of the issues I think that needs to be looked at is the negotiations of the services, the negotiations of the price, the negotiations of what programs are going to be given, the negotiations of the benefits. So if a healthcare insurance doesn't negotiate with the private GRMC a negotiated agreement that both of them agree to, then they can say, no, you cannot go, because then they won't pay for the services. And that's what's happening now. And so it's a market forces, private situation, and I don't think that can be legislated, but on the government side, it can be legislated. And so not having a health insurance company agreeing to provide, to use GRMC as the service, right? That's your question. As the service is something I think that needs to be negotiated between GRMC and the health insurance company that's providing the payer. It's unfortunate that, yes, health insurance are dictating where patients have to go, and that's something that needs to be really changed and turned around. It has to be the patients. Thank you.
Lieutenant Governor?
Thank you. I've been part of this process for the last 8 years. I've been dealing with the negotiation team. It's already established by law. It's already set up. We deal with the retirees, of course, the active employees. We deal with legislative representatives. We work together. And the governor's right about going to the legislature, because you got to be careful what you ask for. You just might get it. They want to go lowest bidder, and then that's direct contradiction to what Senator Rodriguez talked about. He's like, patients need to be able to decide where they go. Look, folks, we're people. You need to go where the doctors you know can take care of you. You need to go where you know, and you already have a history, you have a record. If you're looking at saving money, you can always, it's a race to the bottom. But what are you getting? You have a relationship, you need to make sure that people have the ability to come here, absolutely. And we have these numbers. Say if you go single provider, you're going to say this pie in the sky number. That's great. Really? You're really going to be able to do that? What about the inefficiencies? What about the choices of the doctors? People that you want to go and get that care from, you can't do. You go with a single provider, you go race to the bottom. The cheapest, look, we can always eat the cheapest food, right? Is it good for you? Is that what you want? Because you can go bologna and bread every single day and every single meal and save a whole bunch of money, but it's not healthy in the long term. If you go to the cheapest medical, is that in your best interest? I don't know that that's what we're looking for. We're looking for good care. That's really what's important, our people's care. The retirees, every time I go to them and talk to them, I said, what do you want? We want choice. That's what they need. That's what they want. This is not Burger King. You don't get what you want, but you get what you need. And ladies and gentlemen, the government of Guam has provided those care. We've had multiple options. They wanted a multiple choice. We gave them all the options that they wanted. We had a single carrier before. They said, get away from it. Look, ladies and gentlemen, be careful what you ask for, which you just might get it. As governor, I'll continue to do the good things for the government and make sure you have choices. Thanks for the question, though, Joy.
Thank you also for the question. All of us are parents, grandparents, aunties, uncles, daughters, sons, and so we have people that we care very much about, that we want to take care of. And when any of our family members or close friends get sick or have some kind of harm done to them, we want to make sure that they have affordable, competent health care. And so when we're talking about health insurance, it is about freedom of choice. It is about wanting to be able to choose through your own research, through your own review, through the background information, through talking with others who have had experiences with certain professionals, healthcare professionals, whether or not this particular doctor is one that is going to be able to respond in a way that's going to meet all of your needs, going to meet all of our children's needs with compassion, with professionalism, with the kind of training and background and experience that matters to ensure that we feel confident about the health care that we're receiving. And so it is about promoting options, about allowing our community to make those choices of who they want to go to. And the other area that we would want to stress is also ensuring that healthcare insurance covers behavioral health and wellness. Because we have heard from many about how it has become so difficult for them to receive the kind of health and wellness care that we all know is very much needed in our community when it comes to mental health and behavioral health. Thank you.
Thank you very much, Ms. Santiago. Do we have another question? Okay, this is actually one of our rock stars here at the hospital, well, movie star. If you've seen the video that the hospital has on YouTube, Madonna and Child, this is Madonna Arjones. Yes, ma'am.
Hafade. Hi, so I work at the business office here at GRMC. However, last year, to be exact, August 31st, I experienced a stroke. And to top it off, I was actually 36 weeks pregnant to my daughter. Because of our neuroscience team here at GRMC, I was able to have my clot in my brain removed without any invasive surgery or whatnot that might have harmed my baby. So as you can see, I'm fine. I'm talking to everybody. My daughter is going to be 1 year old soon. She'll be 11 months. So my question is, if you were all elected, or if any of you were elected to be governor, to ensure that GRMC survives so we can continue, how can you ensure that GRMC can still provide medical miracles just like what happened to me?
Senator Liu?
I think we have to be very business friendly, and we have to make sure that we improve the efficiencies in whether we are getting nurses to be licensed or whether we are getting medical professionals to be licensed. And you're absolutely very good in the hands of this neurosurgeon. And I've heard other great stories like yours, and that's because we have the specialists here. So we need to really As governor, I will make sure that whatever the medical board examiners and the nursing board examiners are doing, we're going to make it more efficient so that a nurse that's applying at GRMC and needs to get her license doesn't need to wait 3 months or 4 months to get a license. The same with the physicians. A physician that is applying to have their license here doesn't need to wait 5, 6 months. Those are the kinds of things I think that government can provide so that we can incentivize and motivate specialists to come here and nurses to get here also. The other thing that I would like to also see is we'd like to look at the pay scale for the nurses. I know you're a private hospital, but I know you also pay comparables. So with me, I would make sure that we have a pay study, a special pay study for nurses so that they can really be paid what is compensated for the value of their work. So whatever kinds of regulations and rules that are there for healthcare services programs and even licenses, we will make sure that it becomes efficient and business friendly to not just GRMC, but also the private clinics. Thank you.
Thank you. Governor Sheriff.
Everybody's just grabbing their
There we go. We'll just keep it interesting.
Well, you know, miracles happen everywhere. Let me just tell you also about the miracle that happened at Guam Memorial Hospital when my second grandson was born, Liam. And he was not going to pull through, save for Dr. Rick Eusebio and Dr. Mike Cruz. And it was few days old, but they were there. And they provided the health care necessary to be able to have my son, my grandson now at 7 or 8 years old, I forgot already because he's growing fast. But ladies and gentlemen, having said that, you're asking the question, how do we keep this hospital survive and be around? That's the question, right? How do we ensure? And I said earlier that this is going to end up as governor of Guam. I'm going to make sure that I personally will be the one negotiating with the team, with Verzon and Dr. Cruz and Eric, and everybody's going to come together and say, how do we make one caregiver on this island with two entities, serving each other, serving the people of Guam, figuring out how that we can trade the best that we have there and the best that you have here, the facilities you have here. How do we get Naval Hospital to come here and the veterans CBOC to all come together as one caregiver on this island so that we can make sure, because we cannot do without GRMC. I was so happy when Peter Scrove brought out, I didn't realize it was going to happen, but it happened. God bless GRMC for being bullish on the territory of Guam. So we want to make sure they stay here. Even the QC, I don't know if they gave you enough QC, but maybe we'll look at it and give you a little bit more to make sure that you stay here.
Thank you, sir. We like that. Lieutenant Governor.
What's your girl's name?
Safira.
Safira? She'll be one on August 31st?
No, on September.
Oh, September 31st. Yeah. Okay, well, happy birthday in advance. Ladies and gentlemen, it really comes down to a number of factors. It really does. One, we all have to coexist together. We all have to work together. We have to live together. A lot of the people you've heard said the same thing. We have to coexist. GMH and GRMC, you'll always be part of the medical system here. There's no question about that. You are. We've supported you. This administration has been a big part of why GRMC is built and the success you are. It's probably the best prop I can possibly have, because our administration has been absolutely here from the beginning. We work with, and every one of us has other stories. You know, Dr. Mike and other doctors attended and nurses attended to my mom, and God rest her soul, she didn't make it, but they were there for them. When you need it, you need those doctors. And I think it's important for us, again, to raise our expectation. I believe in Guam, and I believe in all of you, in your abilities to do the job. And I also believe that we have the capacity, and we will establish a university hospital. And I also want to make sure that we invest in our people by the tuition-free college to be able to get more nurses and more expert, higher-paying jobs for our working-class families. We need to have more expertise, more people contributing to the tax base by virtue of getting the education, to get them the skills, and keep them here on Guam, contributing to the tax base. We have to do the information technology, as one of the previous candidates spoke about making sure efficiencies are in place so people get paid quicker. So you're not waiting around for that money, and Eric's not asking questions that, hey, how can we get money faster? That comes down to money. Hiring the right personnel, getting information technology, which Governor Tenorio and Lieutenant Governor Toniato will do, because we need to evolve as a government. We need to raise our expectations, raise our standards, raise the outcome, make sure we're raising your kids, because we want to not just get to the first birthday, but so many more. So we're here to provide for you. We're here to make sure we lead this government and our community and get the delivery of the services so you don't have to worry about it. So this is Masing. Maraming salamat po. Happy birthday, Governor.
Thank you very much, Lieutenant Governor Tenorio. Senator Rodriguez.
Thank you very much. To Madonna, happy birthday to you and to your daughter. Every day of life is a birthday. And you know, I want to thank the doctors. The doctor, I don't want to violate any HIPAA, but I know I saw a real good neurosurgeon here this afternoon. And so I want to thank the doctors. I want to thank the nurses that create miracles every day in this hospital and all throughout the hospitals. To ensure that this hospital continues to make those miracles happen is to ensure that you're solvent. Is to ensure that when the government sends patients over here to the Medicaid or MIP program, that you're paid. Our plan, this healthcare para todo plan, talks about expanding Medicaid. It talks about creating Manila Plus. That's for our brothers and sisters who come to Guam from the different islands. It talks about the Manila care plan that we have for our seniors. That's how important it is to ensure that people that come to your door, because we know a lot of indigent come to your door, whether they're MIP or whether they're self-pay, those people come here, it's important to ensure that they have a payer attached to them, because that's how you're going to ensure that you're getting paid for the services that are provided here. That's to ensure that GMH gets paid, that the private clinics get paid as well. So that's what we're going to do. And again, to the doctors here, throughout the island, and to all the professionals, Sidus Masi, and thank you very much for what you do.
Thank you, sir. Attorney Luciano.
Thank you very much, Madonna, and also happy birthday to your daughter. When we talk about, again, what we can do to ensure that GRMC remains solvent and also continues to be strong and get stronger really every day as it continues to be a very important part of our community, there are several considerations. The first and foremost, we would say, is that we have a true commitment to affordable, accessible, and competent health care. And that when we say this, that we mean it, and that we are going to be determined to ensure that every aspect that might be a part of this commitment is focused, and that we have the right professionals in place, that we have our healthcare professionals, that we have our financial professionals, that we have our facilities, management professionals, and others that are critical to our healthcare community. Other considerations, we look at the integrated delivery of care system. We look at the continuum of care system. And so when we talk about that, we're really talking about a comprehensive system of care that does involve GMH, GRMC, our community health and community mental health clinics in our villages, that involves the private practitioners and others, and making sure that we are looking at not only the adult continuum of care model, but also what we know behavioral health and wellness promotes very strongly, but that also involving the child continuum of care model. And so thinking along those particular criteria and factors. Reviewing the Allied Health Board rules and regulations. There have been in the practice of law, and as the Attorney General, some concerns about some either contradictions or some weaknesses, and so then ensuring that we're correcting those. And then when it comes to specialized care, we do need to in fact look at fair compensation, reasonable compensation to specialists. Thank you.
Thank you very much. So we're going to take one more question. We started a little late, so we're going to go ahead and go a little late. Is there one more question? Oh, it's our other rock star. We're going to take a question from our Chief Medical Officer, Dr. Felix Cabrera.
Thank you, Cindy. So first of all, I just want to again thank Dawn, I call her Dawn now, so much for being so brave and coming out and telling her story and being part of this. And what she has done is I truly believe has saved other lives as well on this island. Her being able to tell her story. And it really was a miracle, Madonna and child. But the reality is that miracles, by definition, are the rarest things known to man. But what is not rare is one thing that everyone in this room will eventually experience, and that's our own death. Now, I'm not a financial guy, I'm not good with financial numbers, I am good with statistics. And I'm going to quote a few things, then I want to frame that to frame the next part of the real actual question here. So it is known that in pretty much any part of this country, about 10% of the population account for 90% of the healthcare cost. Okay? And even with that, we spend the most of our healthcare costs in about the last week of our life. Okay? That's the real challenge that we have in terms of how we have to balance what's our resources and how to use that best. Okay? Back in 1945, and throughout the country, most of the deaths occurred at home, and that was just a fact of life. By the 1980s, 17%. Okay, and it's probably even around that same amount now. Okay. What's happened is that there's been this shift of something that was very natural, occurring process happening usually at home. Now it's happening in a healthcare setting, in a setting that is unfamiliar to most people at the time of their death. So my question to you all revolves around the fact that a lot of our patients, a lot of their family, they want to be home. They want to take care of their loved one at home, but they need that support. And one of the most tragic things on this island is that we don't have adequate coverage for home hospice care. Okay, that's across the board from the insurances that are here. And also because of that, we don't have that home health industry that really supports home hospice for this to occur in a way that really allows our loved ones to die with dignity. Now, so going to the real question here, and that happens to do with actually a law that Senator Hidalgo Guerrero had written, I believe, 1996, which is the Guam Natural Death Act, which is a great act and it encompasses a lot. But I think that there's more to be said and more to be added to that. And I think that we can definitely model ourselves after other states as well. But it's a loaded question with a lot of background, but I'd just like to know, if you're elected governor, what would you do to help strengthen that act, and what would you do to help make that process more natural when it makes the most sense to be more natural? Thank you.
I was going to offer the Lieutenant Governor the opportunity to go first.
Sure, I'll take that question. You know, Dr. Cabrera, you're absolutely right. And what it comes down to is a lot of educating our people. People or families are afraid to die at home, you know, because they think that they won't have the quality of care at home that they do in the medical facility. And I'm the chairman of the Hospice Advisory Board for one of our local companies here for the past almost 10 years now. And it's educating our loved ones that it's okay. It's okay to go home, be with your loved ones, and see that final days with your family around, to see that final days with all those who love you, come in and see you and be with you. A lot of the insurance companies, they do cover the home care, hospice care, but it comes down to education. It comes down to ensuring that what is it that they want to be provided. Do they want to be provided home care, or do they want to be provided hospice care? Because sometimes the individual goes home under home care, and then later on their condition is not getting any better, and then when they realize that it's coming to hospice care, they say, well, no, I want to go and ensure that they're in the hospital. But Dr. Cabrera, you're absolutely right. passing at home is one of the greatest gifts that we could have with our families. You know, I wasn't able to have that with my mom, and she was at GRMC, like the Naval Hospital, and with my dad too. But if we work together and we ensure that we inform our patients that home care and hospice care is available, and educate them more, and work harder with the insurance companies to allow these types of cares to be provided, that I know that we can make it more available to everyone, instead of them being in a medical facility during those last days. But you're absolutely right, Dr. Cabrera. Thank you for that question.
Thank you, Senator Adams. I'm trying to go a little out of order here than we've been going. Governor Gutierrez, would you like to take the question next?
I believe your question is how do we provide more resources for home hospice care? That's the question. Well, you know, I don't know, but I know that culturally our people have been taking care of that part. Maybe not hospice, but home care. My wife's sister, Sister Mary Helene, was under our care for 10 years. She didn't want hospice care, but we were taking care of her. We hired our own caregiver back and forth when we're not going to be there. On June 28th, after 12 years, we managed to be surrounding her when she wanted to pass at home with our grandchildren, sharing that great day where they believe she just departed when she was ready to, and in peace, and take off into heaven. That's their belief. Now, what can the government do, you know, with people that are scared to go home or cannot afford hospice care? But there are certainly families that we can, you know, have them avail themselves of everybody just coming together as a clan. It worked before. I don't have an answer for you of how we can ensure the grandma that's not covered from anywhere else, and Medicaid having a cap that doesn't cover them. But certainly that's something that I would look at, because I've experienced it, and I think you're absolutely correct that we need to be able to avail ourselves with that peaceful going in the home. And that's part of our culture. I'm just so sorry that it has gone the wrong way, where people are up at the SNU and die there after 12 years. But I don't know the answer, but maybe one of these days we can all sit down and figure out how to be able to make it happen.
Thank you, Governor Gutierrez. Senator Rodriguez?
I guess I'll take this one, because I haven't said a thing yet. Actually, in our Into the Future plan on page 56, you know, we can work with public-private partnerships and get this thing covered. But you know, it actually comes down to a personal choice, folks. You know, some people like their families to die in a hospital, some like it at home. Personally, families here in Guam, because it's a cultural thing, they prefer the hospice approach. And again, it's just working with the insurance companies. Again, you know, to cover a lot of the expenses there. So it's just establishing a relationship, working with the insurance companies, and actually trying to figure out what the family wants. And just boiling down to that simple fact. Thank you for the question.
Thank you, Mr. Cruz. Ms. Alicia?
Thank you very much, Dr. Cabrera, for that question. I think many of us have had the experience that you've talked about because of especially our manamko, our elders who have passed away, and then just being able to very fortunately experience seeing, for example, my grandmother passing at home, but around all of the loving members of the family, taking care of her and actually telling her it's okay for her to go. Because everyone loves her and everyone loves each other, and we're going to all be okay. And that, and being able to hug her before she passes. Senator Uggan and myself, Frank, would strongly advocate with insurance companies for hospice coverage. I also want to reference earlier the integrated delivery care system that I spoke about, that he also spoke about earlier, because we are talking once again about the comprehensiveness of health care that also includes home health care and can also include hospice care. And so if we change the mindset so that we look at healthcare in that comprehensive fashion, integrated delivery care system, that would put an emphasis also on the very compassionate approach that Dr. Cabrera, you're referring to when someone is close to passing. It's also about investing in our families. So when we talk about raising awareness, when we talk about education, that perhaps also inviting our healthcare professionals to continue and to expand on the reaching out to our families about how it is okay. It is actually a very compassionate way of having someone go surrounded by our loved ones. And so investing in the families is another way in which we would advocate and promote hospice care. Thank you.
Thank you very much, and thank you for that question, Dr. Cabrera. Senator Liu, you had been complaining that you kept going first.
I thought you forgot about me.
I did not forget about you, ma'am. I would never forget about you.
You know, I have passed several legislation actually that has helped families to be at the comfort of their homes. One of them, of course, is the end of life legislation, and also the ability for the individual to decide not to be resuscitated and so forth. So those are steps towards the end of life comfort and peace. I think we have to look at it in several ways. One is the financing part. And I truly believe that we just haven't really focused on long-term care insurance or hospice care insurance. And because if we do, the insurance company will see that it is less costly for that patient to be in the comfort of their home and not having to pay out equipment, machines, medications, high labor-intensive individuals. And I'm pretty sure that they will agree. So we just need to make that a priority and focus on that and be very aggressive about it. Then you have to look at the resources, the human resources. And you have to look at the nurses that come. And so we need to provide for hospice care nurses to be able to be with that patient's family, because it is very scary to have somebody come and have end of life, although the benefits of the comfort and the peace and all that will be overcome. So the role of that nurse is to educate the family, to make the family comfortable, to say when the family takes its last breath, just hug the family and kiss them and say, I will be in heaven with you. That is a cultural thing we've always had before. And just one last thing, since my law has passed, there has been many, many more people that have died at home peacefully. So that's how I think we need to address it.
Thank you. And thank you to all of our panel for answering our questions this afternoon. And I was going to say, you looked so lovely standing, Senator Leon Guerrero. Would you like to stand? Oh, Josh is going to take it again. Josh, you look so lovely standing. Would you like to give the closing remarks?
You're the only one who ever told me that was.
Oh, you're so pretty, sir.
Today. Ladies and gentlemen, thank you very much for giving us this opportunity to focus on healthcare. There hasn't been an opportunity like this to focus on healthcare issues in this primary election. Lou and I are running to build a Guam that is fair, that is safe, that's compassionate and prosperous. I'm going to use my experience in all three branches of government in the private sector, combined with Lou's unique background. She still is a registered nurse. She is a critical care nurse vet from GMH. She's run a healthcare organization. She's been an effective senator, passing the Hospice Care Act, banning smoking in bars and restaurants, creating the Healthy Futures Fund that funds alcohol, tobacco, and drug prevention efforts and cancer care. And at the bank, she's managed to expand an organization to expand financial access to the people of Guam, to build homes, to build businesses, to take care of loved ones in good times and in bad. And so in this election, when you go to vote on August 25th, I think you should ask yourself, who do you trust to get the finances in order? Who do you trust to push forward a progressive healthcare platform and program for the island? Who do you trust to take care of the well-being and the futures for your families? And when you ask those three questions, I'm quite confident that the person you're going to come up with is Lou Leon Guerrero, and I'll be humbled to be with her to be elected your governor and lieutenant governor. So I ask you to vote for Lou and Josh on August 25th. Thank you very much.
Attorney Alicia Nunziaco, would you like to speak on behalf of your team?
Thank you again to GRMC for this very important forum on healthcare. On behalf of Senator Uggan, on behalf of Frank and myself, we want to thank you for the very insightful questions, for really in those questions being able to tell us what the issues are that matter most to you and to all of our families. Frank and I are committed to affordable, accessible, and competent health care. We've talked about prioritizing preventative care and a holistic approach that would promote healthy living and healthy lifestyles. Frank and I have the collective experience working in the public service, between our public service commitment in various aspects of the legislature for Frank, and in my legal realm as an attorney, as the Attorney General, and as the U.S. Attorney for Guam and the CNMI. We believe very strongly in inviting our health professionals, our health stakeholders to the table. So when we talk about the integrated delivery care system, about accountable care organizations, about health policy commissions, we are talking about making sure that we have the right people at the table to provide their input, their insight, their experience, their background, so that the right and responsible and firm decisions are made that really do focus on ensuring that the commitment we have made to you as our community is in fact executed and successful. And so we ask you very humbly to consider Frank and I during the primary election on August 25th. We humbly do ask for your support. Please know that he and I are fully committed to working hard for all of you, for our families. We are invested in this community. Our children are a part of this community, and ultimately, all of us, I believe, as I said earlier, our parents, grandparents, aunties, uncles, and we all want one very important thing, really, and that is that our children are safe, that they are happy, that we leave a Guam that is going to provide for them so that they can thrive and succeed and be healthy throughout their lives. And so we are committed to that with all of you. Thank you. Dankulu nasi Zeus Masi, and maraming salamat po.
Governor Crockett-Harris.
Ladies and gentlemen, I've been chastised, and I'm sure that it wasn't my supporters, but they said, why do you keep telling the people what you did in the past as governor, for 8 years? Well, you invited me here, ladies and gentlemen, today, interviewing to be the next governor of Guam. And I trust that you will trust the person that was there before with the same situation and have done the job correctly. We extricated ourselves in the past from the same financial mess we're facing right now, but even double what we were facing right now. You need someone that can get on the ground running in the first place. Ladies and gentlemen, even my opponents tell me that don't vote for Carl Gutierrez because he's old already. You know, but who, I'm the only male gubernatorial candidate didn't take a bathroom break here. Some 3 times. They say, even in Tagalog, they say, don't vote for Gutierrez, is mabaho, amoy lupa. I said, amoy lupa? Yeah. I said, no, hindi. Mabango, amoy tinipig. Ladies and gentlemen, what you're looking for is someone that has been tried and tested. Subok na matibay, subok na matatag. And if you've gone through this same situation you're facing now, you will understand that we cannot. I've earned my Eagle badge. I've traversed this political landscape and the running of government over the last 40 years. I know where the pitfalls are. I know where the resources are. I blazed this trail over. So you need someone that knows where it is. You know, I earned that Eagle badge. But if you want to hire Cub Scouts, that's up to you. But ladies and gentlemen, if you need on-the-job training, that's up to you. But I want to let you know that Fred Bordalio and I have a great team together. Fred is going to be working pretty closely because he's as Lieutenant Governor, he will take care of the clearinghouse, which gets in the grants, and he can maximize those grants. So I'm asking you to take a look at the team that's experienced, that will carry us through these difficult times. Because if you don't hire the experience right now, we know how you know who you're going to trust if you haven't done it before. Mga kababayan, ako po si Carl Gutierrez. Nananawagan na muli sa inyong lahat. Ako po ay nagnanayos na kayo ay muling paglingkuran. Upang sa ganoon po, ay maibalik natin muli ang kaayusan at pagtitiwala ng taong bayan sa ating pamahalaan. Ladies and gentlemen, Gutierrez Bordalio, para sa iyo ang alalan na ito.
Lieutenant Governor Tenorio.
Yeah, I went to the restroom once. Thank you very much. Maraming salamat po. Thank you for being here, Sister Mossy. We're all just people. Every one of the candidates here, they got families, they've been here, they've been treated. We've been part of building this institution from groundbreaking to ribbon cutting and everything in between. We're very, very proud of this institution. This is one of the testaments of how healthcare is improved along with so many other clinics. You know what your families need. I've got family working here. We've known each other since we were kids. We grew up here, raised our families here, and we had our children born and raised and now serving the military or working in our community. We've seen a lot of things, all of us together. Like Governor Carl Gutierrez just said, we've done a lot of things. I've overseen the grants in the Guam State Clearinghouse. I've done public safety. I've done policy making. I've done what it's taken to get where I'm at. I'm not running for me. I really am not. I'm really running for making a better island in the future. I've done over 35 years of public service, but this is about you. This really is. It's about working together, building efficiencies, making it possible to get paid faster, making sure that we educate our people, giving them tuition-free education so they have the skills to get the jobs so they can be contributing members of our community. I want, as governor, to not be able to see somebody standing at the corner of the intersection unless you just want to cross the road. I want to see, as governor, people not resorting to drugs and crime instead of resorting to a career. I want to see, as governor, the investment in a university hospital so that we can teach our next generation of doctors and other therapists and providers. I want to see compensation levels raised so you don't have to worry about looking somewhere else to get more pay. I don't want you to have to work 2 shifts or 2 different hospitals, but we need to raise the bar. We need to raise our expectation. And I think all of you understand that. My partner over here, Tony Ada, is a compassionate man, just like his Lou, just like his Josh. We're all compassionate people. We care about the community. We're here for you. We want to make your lives better. We want to make sure you can have the ability to have your loved ones die at home in hospice or home care, but we also want to make sure they don't get to that stage by having better education, better recreational facilities. We're here for you. If there's something you need from us, we're more than happy to listen. I've been listening for my whole life, as a cop, as a legislator, as now a lieutenant governor. All I do is listen to complaints. And remember, public relations is talking about how many complaints you get all the time. We get that all the time. That's all we do. Every 30 minutes is another problem. But ladies and gentlemen, we're here to lead and guide our island into the better future that you all want. So thank you very much for your time. Thanks for hosting this debate. I appreciate Mrs. Bengzon and of course Lieutenant Governor Mike Cruz, and thank you for all for your time and attention. Jesus Masi, maraming salamat, and please vote Tenorio Valley. Thank you.
Thank you very much, Lieutenant Governor Tenorio. And Senator Dennis Rodriguez.
Again, si Jus Masi, maraming salamat po to Ms. Margaret, Dr. Cruz, and to the GRMC family. Ladies and gentlemen, my running mate, Dave Cruz, you heard a little bit about him speak a little bit today. I want to tell you that he is a great man. He's not a politician. He's an officer just like Dr. Cruz in the U.S. Air Force. He was an educator, a teacher, George Washington High School and John F. Kennedy. For me, I've been a senator for 8 years. I've worked on healthcare issues. I know what the challenges are, and I know how we're going to resolve it. We share with you in our plan how we're going to address the many challenges we face, ladies and gentlemen. I may be the youngest. I don't know if I'm a Cub Scout, but help me be able to, after August 25th, and then when we win in November, to come up and say, Cub Scout reporting for duty, sir. But ladies and gentlemen, but really, I want to be able to serve you as your governor, because I know what can be done as governor of Guam. When you go and you vote when you go in the ballot box August 25th, don't look at us candidates and look at whose turn it is to serve. Look at us and see who has the real plan to take us into the future. Who has the real plans to deal with the problems we have in our community, and who doesn't have the self-interest, ladies and gentlemen, because we don't. We don't have self-interest. We're going to serve you. We're going to work hard for you. Mga tunay kong kababayan, ako po si Dennis Rodriguez Jr. Sana po iboto ninyo si Rodriguez Cruz itong halalan na to. Maniluho sa Meninaho, guaho si Dennis Rodriguez Jr. Iasagwaho si Lina Kitagua Calvo, Gizajigo, Familiang Carabaos, and Familiang Clara. Por favor, on August 25th, bota si Rodriguez Cruz. Si Jus Maasi, maraming salamat po, and God bless you. And to all of you who are in the rooms upstairs, we're praying for you. We wish you a quick recovery. God bless you. To the doctors and nurses here, si Jus Maasi, and thank you for everything that you do. Thank you.
Thank you very much, Senator Rodriguez. Senator Cub Scouts. So we're actually going to call on one last politician to make closing remarks. And I've actually had the honor to serve in his communication department. And that would be our President, Lieutenant Governor Michael Cruz.
To clear the record, I am not a politician. But Senator Rodriguez, thank you for speaking Chamorro, because I was worried that somehow did you tell him that they had to speak Tagalog? Or?
No, sir. I just said be multilingual.
Anyways, I don't want to say much other than to thank you for coming out. We here at GRMC believe that healthcare is in a state of transformation, and we believe we're not only a part of it, we are leading it. And the fact that you've come here today, I think you believe the same thing. But it's important that the people, this is our community. We have a unique opportunity to do something for us. We live too far away to be able to have to get on an airplane, if we can even afford to get on an airplane, to go get treatment. As Governor Gutierrez said, we shouldn't be dying on airplanes trying to get somewhere to get treatment. So this is our opportunity as a community to come together as government, because one of you two is going to hold the highest positions here on Guam. We have an opportunity to once and for all fix healthcare so that all of us can have miracles like Madonna. So thank you for coming.
Thank you very much. Ladies and gentlemen, let's put our hands together again for our candidates who came to join us today. Lieutenant Governor Ray Tenorio and his running mate, Senator Vicente Tony Ada. Senator Lulian Guerrero and her running mate, Mr. Josh Tenorio. Governor Carl T.C. Gutierrez and his running mate, Police Chief Fred Bordallo. Senator Frank Uggan and his running mates, Miss Alicia Limtiaco, and Senator Dennis Rodriguez and Mr. David Cruz. Thank you all very much.